शुद्ध देसी रेडियो शुद्ध देसी रेडियो सॉलिड कलेक्शन है सुरों के एक्शन है दिल से कनेक्शन है सॉन्ग सिलेक्शन है शुद्ध देसी रेडियो शुद्ध देसी रेडियो
Greetings, Should They See Radio listeners. My name is Anki Mahajan, and I am here today with my colleague Rashi Modi to discuss the implications of ovarian cancer and venous thromboembolism, otherwise known as VTE. Did you know that ovarian cancer is the second most gynecologic malignancy and is overall the fifth leading cause of cancer death in females in the United States? This is because VTE is a common complication that accompanies the condition. Thus, we have concluded that there is a significant link between the two malignancies. We invite you to along our journey through our research to find this link. So, Rashi, to get started, could you tell us more about what ovarian means? What are the ovaries?
Of course. Thank you so much for that introduction, Anki. To get a better understanding of ovarian cancer, let's dive into what the ovaries are in the first place to answer your question. The ovaries are located beside the uterus on each side of the lower abdomen, connected by the fallopian tubes. They produce ova, which are the female reproductive cells, and the female hormones, such as estrogen and progesterone.
So then what exactly is ovarian cancer?
Well, ovarian cancer is a type of cancer, otherwise known as unregulated cell growth, within the ovaries of a female's uterus that can be caused by a multitude of factors. This is when the cells within the ovaries malfunction and undergo the cell cycle rapidly, forming abnormal or zombie-like cells to quickly overpopulate the tissue.
That's no good. You said it was caused by a multitude of factors? What exactly are they? And what exactly is the most common cause of ovarian cancer?
Well, at the moment, there are no definite known causes. However, there are a multitude of risk factors, with the most common being genetic predispositions and mutations. Older females are more likely to develop ovarian cancer, as well as those with delayed menopause or the gradual slow and stop of a female's menstrual cycle when she reaches the later stages of her life.
Absolutely. But are there exact statistics for the incidence of ovarian cancer that we ought to look out for?
Yes, there are. Did you know that ovarian cancer accounts for 3% of cancers in females, with the risk being 1 in 78 females getting it? Well, this dangerous ratio equals a lifetime risk of 1.3%, with Caucasians being the most likely to develop ovarian cancer, and Native Americans and Alaskan Natives the least likely. However, in better light, the diagnosis rate of ovarian cancer has declined in the past 20 years. The incidence has significantly fallen from 16.3 cases per 100,000 females in 1975 to 10.1 per 100,000 females in 2016.
Okay, well, speaking of racial demographics, I know myself and many listeners of Should They See Radio are South Asian. What about Desi females specifically? Is our demographic risk-free?
Not exactly. Ovarian cancer is actually the third most common cancer among South Asian females, which means that we are still at a high risk for the disease, specifically 9.1%.
So is there anyone who isn't at risk for ovarian cancer or less so?
Unfortunately, every female is at risk of ovarian cancer. However, this risk increases with age, late childbirth, menopause, and endometriosis, which is where the lining of one's uterus grows irregularly and often outside of their organ.
Okay, I see. Can you go more into detail on these risk factors, Rashi?
Sure, Anki. So, incidence of ovarian cancer does increase with age, as I mentioned before. There's a shocking 17% incidence rate among 75 to 84-year-olds. It usually develops after menopause, as I also said before. Obesity can moderately increase one's risk, as well as nulliparity, or not undergoing pregnancy. Hormone use after menopause, such as estrogen use, smoking, and past family history, can all further contribute to the risk of ovarian cancer.
So then what are the symptoms of ovarian cancer that one can look out for in themselves or in any of their other relatives or close family friends?
Great question. Knowing the symptoms of ovarian cancer beforehand can really help with early detection. In early stages, symptoms of ovarian cancer can include bloating, pain in the pelvic or abdominal region, and increased urination. In later stages, females may experience constipation, nausea, ascites, and/or significant weight loss.
Are there different types of this cancer? If so, what exactly are they?
Well, ovarian cancer can be the result of many different types of tumors. Epithelial tumors, germ cell, and stromal tumors are all contributors to the unregulated cell growth in the ovaries. First, epithelial tumors form in the fallopian tubes and reside on the thin layer of tissue that forms around the ovaries. These are by far the most common in ovarian cancer, accounting for 90% of all cases. Then, germ cell tumors are located on the egg or gamete-producing cells of the ovaries and are very uncommon, accounting for only 2% of all cases, mostly by those in their teens and young adults. Another kind would be stromal tumors, which are found on the connective tissue of the ovaries and are most commonly a result of hormonal imbalances.
Thank you, Rashi. I recall earlier you stating that there's a link between venous thromboembolism and cancer. Could you explain more about this? How does VTE tie into ovarian cancer?
Well, this is a very important question that I'm glad you asked, Anki. Certain treatment options for ovarian cancer can lead to VTE, making doctors find new treatment options for their patients. Some treatments can cause bleeding and bruising, causing blood clots to form unnecessarily and contribute to venous thromboembolism. More advanced treatment options can even harm the platelets, which are a key cell in forming clots. For example, chemotherapy, the most successful, causes a VTE incidence of roughly 12.5% because of blood vessel damage and a reduction in proteins that prevent blood clots. Radiation treatment has a VTE occurrence around 8%, while surgical intervention has a VTE incidence of 4% due to immobility from the surgery.
Wow, other than VTE, are there any other complications that are associated with ovarian cancer?
Well, ovarian cancer does come with many other complications, which are including but not limited to VTE. Metastasis, or the rapid spread of cancer to other parts of the body, is very common. Bowel obstruction in the pelvis and abdomen is a direct result of this, along with a perforated colon. Blockage of the ureter and urinary retention may accompany the cancer, as well as pleural effusion, or the buildup of water outside of the lungs, and bone pain.
So then how do you go about diagnosing ovarian cancer once you do recognize the warning symptoms?
Well, although ovarian cancer is difficult to diagnose, there are some options that you can consult your healthcare provider with. These include a pelvic exam, transvaginal ultrasound, or TVUS, which uses sound waves to detect tumors, but they cannot distinguish whether a tumor is cancerous or benign. And you can also use an abdominal or pelvic CT scan.
Okay, well, considering you are able to obtain a diagnosis, how do you treat ovarian cancer? Is there a cure we can look forward to?
Although there are many different treatments administered to patients with ovarian cancer, there is not an official cure for any kind of unregulated cell growth as of now. That's why it's important to catch these symptoms early on when there is a better chance of combating them in early detection.
Got it. So then what's the most common treatment?
Well, I think I mentioned before that chemotherapy is a common treatment that involves administering the patient with powerful chemical drugs to kill the cancerous cells. However, there are side effects, which include hair loss, fatigue, and the incidence rate of VTE being at 12.5% because of the damage in blood vessels and a reduction in blood clot preventing proteins, also known as natural anticoagulants. Another form is radiation therapy that directs high energy electromagnetic waves towards the tumors. This results in a VTE occurrence of about 8% and can include side effects of skin blistering, fatigue, and nausea. Lastly, surgical intervention is another method of treatment that involves the surgeon manually removing the cancerous tissue and malignant tumor. The chance of developing VTE is very low at about 4%, but the surgery renders patients to long periods of immobility before and after, which is where it gets its occurrence from.
Got it. So I know in the case of breast cancer, you can take a mammogram to detect if there is a tumor. Is there a mammogram or any other sort of test that a physician can give if a patient is especially at high risk, especially if this risk is from past family history?
Yes, actually. So physicians can administer an annual pelvic exam specifically to high-risk females with a genetic predisposition to ovarian cancer. We strongly encourage females to get these exams done yearly and avoid putting them off. We know that these exams can be easily overlooked. However, pelvic exams and other tests for cancer can help with early detection and therefore lead to easier treatment. A pelvic exam can detect cervical cancer as well as ovarian cancer. However, detection of ovarian cancer is its main purpose.
Got it. What about the survival rates? Is the outlook grim?
Actually, you have a good chance of recovery. If the cancer hasn't metastasized in a 5-year period, you have a survival rate of 92%, as compared to cancer that has metastasized, still giving you a 45% survival rate in a period of 5 years.
All right, Rashi. So if I understood correctly, allow me to conclude this. Ovarian cancer is a serious condition with several associated complications, including VTE. Accordingly, the risk seems to be specifically tied to the type of cancer with the highest incidence, epithelial ovarian cancers, otherwise known as EOCs. The type of treatment registered can further increase or decrease the risk of VTE, but additional studies are needed to clarify this matter further. Finally, VTE prophylaxis should be considered in high-risk patients with EOC. Does that sound right?
Yep, you got it, Anki. Do you have any other questions?
No, that about concludes our session. Thank you, Rashi, for your insight, and thank you, Should They See Radio listeners, for tuning in today to take the time to learn more about cancer and VTE. Once again, I'm Ankita Mahajan with my partner, Rashi Modi, and we hope you all have an amazing rest of your day from the Global Thrombosis Forum, or GTF. Thank you.
Thank you.
देसी रेडियो सॉलिड कलेक्शन है सुरों के एक्शन है दिल से कनेक्शन है सॉन्ग सिलेक्शन है शुद्ध देसी रेडियो शुद्ध देसी रेडियो